welcome to Care Lab.
Hi, welcome to Care Lab. We have an amazing guest here with us today. This is a guest that I have been waiting on bated breath for because we're going to be talking about music and music therapy, which Brandy and I have talked before about, how important music is to everyone and certainly to us. So we have here with us today Tara Jenkins. She is a board certified music therapist and certified dementia practitioner. She has been dedicated to the dementia care community since 2007. She's the co-author of Music, Memory, and Meaning. She founded Harmony in Dementia, which offers music therapy services, consultation, training, and education for older adults, caregivers, students, and professionals. And we are thrilled to have you here with us today. Thank you so much, Tara.
Oh, you're welcome. Thank you for inviting me. I'm really excited to join in on the conversation.
Yeah.
So, before we get started talking about the important things, music therapy, and how it can change people's lives in dementia, which it really, really can, we need to start with some nonsense because that's what we do. So we're going to start with an icebreaker question for you. We all have to answer, but you have to answer first because we're
Okay.
rude. And today's isn't too bad. So are you ready for it?
I'm ready.
Okay, so today's question is, so there's a lot of scary stuff going on in the world right now. It can be a dark and scary place or feel that way for sure. What is something though that makes you feel hopeful?
Ooh, that is a great question. I think for me, it's the everyday meaningful interactions. I see that a lot in my work, but even like in my community, I'm in Wilmington, North Carolina, and I'll shout it out because we moved here a year ago and we've been so embraced by this
Oh, good.
community. But like just from neighbors saying hello to, someone recommending restaurants, or in my business, like everyone has been so open and welcoming with referrals and things like that. And I feel like those connections are still present. So I think trying to connect to your community, I think gives me hope, and whatever that looks like for you. So I think, for some people it might be volunteering, for others it might be just like going out and supporting your local community. And for me, I'm all about meaningful connections in my work and in my life. So I think trying to focus on that, which can be hard with everything going on. But yeah, that's what came to mind when you first said it. So
I love that.
I love that too. That's good and hopeful. I like that. Mine is I like seeing the world through kids' eyes.
mm,
And so like they're so unjaded and
hmm
at least for my own kids I try to protect that as much as I can, but just like seeing it from their perspective and like understanding like the questions that they're asking and the reason they're asking them, the reason why I don't ask those, right? Like, oh, why don't I ask that question? Why couldn't it be that way? And I just love how they have a brand new look at the world and that creates all these possibilities that sometimes you just kind of feel like are no longer possibilities, but you don't really have a good reason for it. It actually could be if you stepped outside the framework that we're used to operating in as adults. So that's my hopefulness.
I love both those answers, and I feel like I get to experience both those things all the time too, and both of those things also bring me hope. My older son in particular he's a big like challenger when it comes to that. He's like, I'll
Mm.
be like, well, we can't do it that way. Well, why can't we? Like he will always come up with a solution. He was like, well, we could try it like this. We could try it like this. And at first it's sort of like you're like, oh, I said no, we can't do it like that. But then, if you really think about it, he's like, well, okay, well, why can't we try it like that? And it's a wonderful quality to have,
Mm-hmm. Mm-hmm.
even though sometimes he challenges me with that. But my answer is also kid related, but it's not the same.
Okay.
So I think just seeing the way that my kids interact with other kids, and that those like the way that just children interact together overall gives me
Mm.
a lot of hope. I feel like back in the day when we were growing up, it could be pretty rough out there on that playground, right? If you looked different, if you sounded different, if you didn't quite fit in, it was a no holds barred kind of world. And that's not to say that kind of stuff still doesn't happen, but I'll give you an example. We were watching my 10-year-old and I were watching a show like last night or the night before. And in the show, it was an old show. It was from like the 90s. A little girl was getting bullied. And he was like, Mom, this is so unrealistic. This would just never happen.
I
that's
love
awesome.
that.
Yeah,
Yeah.
that's awesome.
I know. And I was like, wow, That's amazing, because the interactions that I see from like outside are that my kids and their friends are really kind and respectful, and they support each other, and it's really wonderful that they do that. But to hear him say like that would never happen was incredible. And I was like, actually, back in my day, that definitely would have happened.
Yeah.
That was a realistic depiction of the early 90s, my love. But anyway, so I thought that was really cool. And stuff like that, I think, gives me a lot of hope.
Yeah, I think as a society, we spent a lot of effort on trying to like be a little bit more inclusive, despite what maybe is happening right now verbally. I mean, from the top down, but from the bottom up, I feel like there's been a lot more of that, and calling out bullying and putting words to it. And it is cool to see like it actually play out. Like we see it happen over time because we're adults, but like they have only experienced life in this way. And so it's cool to see that, because I have had that happen. We had a different interaction yesterday, in which ever since my kids have been old enough to talk, my son especially, like he'd go to the park and immediately be telling every kid what to do and let's play this game. And he's always organized. And then for the first time, I think probably in his life, which is why he cried so hard, yesterday he was outside after school and the kids didn't all want to do what he wanted to do. They were older kids. And that was really hard for him to deal with. But usually it's just like so easy for them to interact on the playground. So I'm glad to see that your son felt like that was unrealistic. That's good.
Yeah, it was unreal. And I think you're right. We've put so much intention. I feel like our generation of parents have put so much intention into like teaching our kids to be kind and compassionate and inclusive, and to actually see it play out, especially in light of what is happening all around us from, as you said, like top down, and how disturbing a lot of that is to see from the bottom up that these lessons have taken hold gives just a lot of hope for the future.
Yeah, well, and I've noticed too, younger generations calling things out more, like even on social media in a positive way, but being like, I'm not going to stand for this, or even in my profession specifically, but in life, but younger music therapists being like, I'm not going to be treated this way in this job. Whereas I was in a very toxic work environment, and that's why I went into private practice the first time around. It kind of pushed me into that direction a little bit. And then I found out I loved working for myself. But I've started to notice that younger music therapists and younger generations in all professions are starting to share more of their mental health and what it's like to live, with XYZ, whatever it is, and being very open about those conversations. And I think those are so helpful, because then you're not alone. And so it's also encouraged me to talk more about it. And so that, for me, that brings me hope as well. But hearing it in the younger generations, and then I'm seeing it, I'm a childless couple. We have a dog. We have lots of nieces and nephews, but seeing it through their eyes and their, early 20s, and then seeing how that group of people are kind of challenging and saying, no, this isn't okay, or this doesn't work for me, I think is really inspiring. And it's also encouraged me to do more of that too.
And it's such a good thing, because when we can say, we don't get what we need unless we say what we need. And if we can all like say, our needs and desires, that helps us to meet each other's needs and desires in a way that is supportive. And getting back to your hopeful part, like builds community, that we can all kind of be there for each other. And that's just, what's not positive about that? We should direct the conversation though towards you, our guest. I'm wondering, we may have some listeners who have never even heard of music therapy before. Would you just take a second and define what the heck is music therapy?
Yes, I'm happy to. And it is something that I usually do, I will say, because you've got people who have heard of it, or people who've never heard of it, or somewhere in between. But as a board certified music therapist, music therapy, the discipline, we are clinical and evidence-based. So we're an evidence-based practice, and we use music to accomplish individualized goals and objectives. So the idea is our work is supporting clients' social, emotional, cognitive, physical, communication, musical, and spiritual needs. Sometimes we're focusing on all of those things. Sometimes we're focusing on one or two of those things. And we're using different aspects of music to achieve individualized goals, both in and outside of session. So we assess each client's strengths and needs, and then we tailor treatment. And that can include creating music, singing together, moving to music, listening to music. And I always like to stress that clients do not need formal music training to benefit from music therapy. So you don't have to play an instrument. You do not have to be in a choir, nothing like that. You just have to have a love and enjoyment of music. And that will go a long way. Now, if you are a musician, then I would kind of tailor what I do and how I do it. I would work a little bit differently with somebody who has more formal training. And then to become a music therapist, this is the other thing that a lot of people don't always know. We have extensive training. So it's a degree program. You can get your bachelor's in music therapy, a master's, or a doctorate. But for the bachelor's program to practice, it's 4 years of coursework, and that's followed by a 6-month internship. And that totals about 1,200 hours of clinical training working with different groups of people. And our degrees require knowledge in psychology, music, and medicine. And so once we complete all of our education after that internship, we sit for the national board exam, and that gives us the credential MTBC, or Music Therapist Board Certified. So I always say anywhere a nurse can work, we can work. So you can see us in a lot of different spaces. And the other thing too is we also have state licensure, but I will say we're still working on that. So not all 50 states have the licensure, but we have a good amount that do. And that is to provide additional protection, not only to our clients, but also to hopefully get them more support and more funding for services as well. But each state, it's a little different. So
I'm so glad that you leaned into the clinical nature of music therapy. Will you talk a little bit about how music impacts us, like neurologically? Like why is it a treatment modality?
Of course, yeah. So what is really special about music is it activates many areas of our brain all at the same time. So, and it really can activate the areas with memory and emotion. So we can all listen to the same song and have different reactions and emotions based on past experiences. And our neurons are continuing to fire until a connection is made. And that's one of the reasons why it's so powerful with older adults and people who are living with dementia, is because even if there are areas of the brain that are affected, our neurons again are firing. It's multisensory. So you're getting all these different sensory inputs, and that gives more of a chance to make that connection for them to give input back, if that makes sense. So, yeah.
I think that obviously you could use music therapy, as you said, like anywhere a nurse works, anywhere an OT or PT works, you could have a music therapist as well, and it would be incredibly beneficial. So I imagine you also work with really diverse populations, right? You could work with children, you could work with adults with brain injury. You have chosen to really focus in on working with people with dementia. Can you tell us a little bit about kind of how you decided that was, the group of people that you loved to work with, and then a little bit about what some of the great benefits of music therapy can be for people who have dementia? Hey there, it's Amelia. Listen, I am so thrilled to have a great resource like Ask Sammy as part of the Care Lab team, and here's why. It's a game changer for aging in place because it makes it so simple. All you do is ask. Just type in your question or even tell Sammy what the problem is and get tailored solutions. Everything from innovative adaptive equipment to comprehensive resources. It's a great way to become more empowered, to live more independently, and to live with greater confidence. And my favorite thing about how Ask Sammy works is it's deeply rooted in dignity and practicality. So whether you're a fellow therapist, a care partner, or someone who's seeking solutions for themselves, visit www.asksammy.com. We're going to link it in the show notes so you can find it there. Start making home more accessible today. Now, back to the show.
Sure. So my grandmother was in a nursing home when I was, I want to say maybe in high school. And she had it wasn't a traditional dementia. It was more depression focused, but also presented with symptoms of dementia. And eventually it was just she needed to be somewhere where she could be cared for 24/7. And in high school, I didn't know all of that. I knew some of that, but not all of that information.
Of course.
And now I know even more. But she loved Frank Sinatra. She loved, crooners. That was more her style of music. And I just knew there was a way to reach her. And we didn't even necessarily engage in music too much, but I could see when she would make a connection. She would maybe call me by the wrong name, but she knew my face. She knew exactly who I was. And I just felt like there was more I could do for her, but I didn't know what that was. So that was in the back of my mind. And then when I was in high school and thinking about colleges, I knew I didn't want to teach music, and I knew I didn't want to be a performer. I was an anxious child and had anxiety, and performance anxiety was pretty big for me as far as playing my primary instrument, which was French horn. I did audition and get accepted into a school to play French horn. For music therapy, you have to get accepted on a primary instrument, which could also be your voice. But yeah, so you're accepted. And again, each program's a little different. I went to Shenandoah University, so I was accepted by the university and the conservatory. So there's kind of two acceptances there. So yeah, I knew I didn't want to go that route. And so I just started exploring what else is out there for music. And I came upon music therapy. And my band director knew somebody who went to Shenandoah University, which is where I ended up going. I applied to a couple different schools, and that's kind of how I got started. And my first practicum which are like rotations, was with older adults. So it was in a traditional nursing home setting. And that's actually where I did my 6-month internship. So it was kind of a full circle. It was the first place that I went out into the world as a student music therapist. And it was where I completed my education before I sat for the board exam. And it just really clicked with me. I really connected with that group of folks. And I just felt like this is what I should be doing. I don't really know how else to say it other than that.
Yeah.
And I worked with lots of different ages. I worked with little kids. I worked in mental health. I worked in rehab for different rotations. And when I went through it all, I just kept going back to older adults. And so my 6-month internship was in that nursing home as a, full-time intern music therapist. So my supervisor was my music therapy professor and the activities director, doing individual and group services. And what I think is so powerful, we hear a lot about the power of music, especially with dementia care and the documentary Music in Memory. A lot of people know the video of Henry, and you can Google it. I believe he listens to Cab Calloway, and you can see his whole face light up, and he's listening with headphones. And, it was great for music therapists because we were doing all of this work. And I was like, I get to see that every day. Like, I really get to see the best in my clients. Because music can be so powerful, and it's because musical processing is generalized throughout the brain. So it's not localized in one area. So I always give the example, it's why someone may be able to sing, but they can't speak, or they have difficulty speaking. And so I get to see moments like that throughout my work. And like I said, music is so powerful, and it can bridge that gap. So if somebody is having difficulty connecting to their past or connecting to their identity, sometimes music can bring that back out. So you may hear a song, and then that connects you to a memory, and then that takes you down a conversation. So an example of that could be sometimes, I ask questions before we start a song, and a client might not be able to really converse with me. And then they listen to the song, they engage, they're singing, the different areas of their brain are activated. And then you ask questions again, and they're able to answer those questions that maybe they weren't able to answer before, or they're able to engage in a meaningful way, and it looks a little different. And as a music therapist, we are doing singing, moving, listening, and playing. So I bring instruments. I have a whole collection over here that you can't see, but drawers of cabasas and maracas and tambourines and drums. And so I bring all of it. And so in a group setting, we're doing lots of different things. We're moving, we're dancing, we're singing, we're reminiscing. And then in individual work, then we're going a little deeper, because I can tailor it. If people love music from 1965, that's where we're going to stay. If people love the Beatles, or I just had a client request Bobby Vinton. So we're going to be sharing his music next time around. And in a group setting, because I never know who's going to be in my group, sometimes I'll have someone who's 50 years old along with someone who's 90 years old. So music preferences are going to be different for those two individuals. So I try to focus my groups around themes, but I keep it broad enough where I can include music from different genres and decades. So it was kind of a long answer to your question.
It was beautiful. It was perfect.
Okay.
Yeah, and I love that. It's kind of like hacking your brain. And can I tell y'all this thing that I think is so cool?
Yeah.
That has to do with music. So my husband has hijacked this. And so what he does is listen to and pick a particular album that he wants to listen to. And then when we go on vacation or go do something fun, he listens to that album the whole time we're gone. So that then when he listens to that album again later, he gets to relive the experiences of being in our vacation. And when he said, and he like loves music so much. And so when he told me that, I was like, that makes so much sense. Because, when you listen to a song, it can immediately take you back to a set of memories. Even though I haven't done that in such a strategic way as he has, I can hear a song and be like, oh, I remember when I used to listen to the song a lot, I was doing X, Y, and Z. And so to be able to do that with clients who have dementia, can not only just like be fun for them and take them out of the space that they're in now, but also like decrease agitation and improve their engagement with others. It also helps, like, especially in facility settings, people to know them. You know what I mean?
Yes.
Like people who are working with them to know that, like, they should always know that they're a person. But sometimes when you don't get to express who you are and yourself, your personality gets flattened in the minds of other people who haven't known you for your whole life. And so I've seen this happen, being in places and hear the music and see everybody light up. And so I just think it's so cool that, like, you're doing a type of rehab, in my mind, that is not painful and hard for the patient. Like, we're always doing hard stuff. They're like, I want to do this. And you're like, ooh, yes, we can do some fun stuff, and it'll also have benefits. So my question to you, though, is how can either therapists or families with somebody who has dementia take some of those strategies and expand on them or use them for themselves so that, like, like you said, you had that immediate change of being able to answer questions after hearing that music. How could somebody use that to do life a little bit easier?
Sure. Well, that's a lot of what my education, the webinars and workshops and different things I do. A big focus is talking with caregivers because there aren't enough of us. The reality is, I think there's a little over 10,000 music therapists in the United States, and not all of us work with people living with dementia. So that number is even smaller.
Sure.
And I firmly believe that everyone should have access to their music. Like, everyone should be able to access music that is important to them. And that's partly why I co-wrote the book, Music, Memory, and Meaning, because it's kind of a guide for caregivers. So that's another resource. But I would say starting with music preferences is really the most important part. Because that will guide you. And when you're working and caring for someone living with dementia, we're all a bit of a detective. And so you kind of have to be with music preferences as well. You always want to start, if the person can tell you their preferences, that's where you want to start. You want to start with the person who you're trying to find out music preferences. If they cannot communicate it to you, asking family and friends. I had someone who, they're across the street neighbor. They were neighbors for like 30 or 40 years, and they used to go to live music together. And so a lot of music preferences were known by that neighbor. So they were like, oh, we went and saw this band, or we went and danced here. So that's a place to go. If you don't have that, if you're working with someone who maybe does not have any family or friends that are accessible, then you want to, there's a lot of research out there that says music from our late teens and early 20s. So I always say it's a good starting point because that music is stored more kind of in our long-term memory. It's kind of more concrete. So if you figure out how old someone is and kind of do the math, and so maybe it's 1970 is kind of that sweet spot of late teens, early 20s, then you kind of want to explore that and you can also ask either or questions. So do you like rock and roll or classical? So if someone can't tell you in a conversation, giving yes or no questions or either or questions can make it a little easier too. So if all else fails, it's a guess and check. And another great starting point is exploring someone's musical collection. So that's something else I've recommended. So do they have a record collection? Do they have digital playlists that they've created? You know, for a lot of us now, that's where our favorite music lies, is in our playlist. So what does that look like? Can you explore that with them? And that may bring up memories just looking through the record albums or the CD jackets or the A-track tapes, whatever it is. So that's a great way to explore music preferences as well. And I always say the starting point for music from our late teens to early 20s. As a music therapist, I recommend us as therapists don't stay in that box, because we have the education and training to go beyond it. But it's a great starting point if you don't know where to start. It's a really good point. But I have taught new music to people living with dementia. Bob Marley's Three Little Birds. I had a group, no one knew it. And I taught them the song and they loved it. And we sang it together, and it's a very repetitive song, and the chorus and the melody are attainable and accessible. So don't be afraid to also try new music. And if you're a caregiver or a family member, a fun activity is kind of compare and contrast. So you can use, I'm trying to think of the song Blue Moon. I was actually just talking about this song. It's a song from the 30s. It then had a resurgence in the 60s. I think over 50 people have recorded it. So you could listen to the doo-wop version. You could listen to Elvis's version, which is very different. You could listen to Frank Sinatra's version. Another example, Blackbird by the Beatles. Beyonce has an amazing version of Blackbird. And I've shared that with older adult clients who love the Beatles. And then we've talked about, what do you like about her version? What do you like about the Beatles version? So that's something that you can do with grandchildren or nieces and nephews, having them share their favorite songs. And, it might be music that they're like, I don't like that, or that sounds like screaming or whatever, right? I had a client who, I don't agree with this, but she thought Aretha Franklin screamed. And so she did not want to hear Aretha. I firmly disagree, but that's her preference. And I went with it. So yeah, it brings up conversation. It brings up these meaningful connections, and you never know where a song is going to take you. So I would say music preferences are the best place to start. And then setting up your listening environment. I think that is really important. As people live with cognitive changes, and when you're thinking specifically people living with dementia, a lot of times they can become overwhelmed or become overstimulated because our brains can no longer decipher auditory input. So if somebody is talking in another room and the TV's on and then I'm singing, that's a lot to process and figure out where that's all coming from. So can you be in a quiet space? And I do that too when I walk into a community. I turn off the TV, the radio, if somebody's vacuuming, or, if staff are charting and they're close by. I do as much as I can, right? Sometimes the environment, it is what it is, but how can I limit what is going on in the environment to make it less chaotic? And so to do the same when you're sharing music with a loved one, I think is really important. Also, headphones versus a speaker. Some people don't like the tactile experience of headphones. Sometimes with hearing aids, there can be some issues there. So just doing what they're comfortable with. And if you want a shared experience, you want to be able to hear the music as well.
Care Lab listener, I have a question for you. If someone you love was going to hire a caregiver, what qualities would you want that caregiver to have? You probably want them to be reliable, trustworthy, kind maybe, just a generally dependable good person, right? Second question, would you also want them to be trained? I'm going to guess the answer is an emphatic yes. Okay, third and final question for you. Do you think it matters who provides that training? Like, is it cool if it's just anybody? Or would you want that person providing the training to be a qualified expert? Assuming you do, in fact, love this person that needs a caregiver, you probably want the expert, right? Well, that's what Higher Standards Caregiver Training does. Higher Standards Caregiver Training provides 100% occupational therapist-led training for caregivers. Caregivers get taught everything from gold standard foundational skills for transfers and activities of daily living, all the way up to how to deal with specific diseases, injuries, and illnesses. And most importantly, they are taught these things in a practical way that enhances the participation of the person being cared for, and it protects the safety of everybody involved. Why? Because everybody deserves a higher standard. Find a course for individuals or learn about training for care organizations at higherstandardscaregivertraining.com.
So a speaker works for that, or an audio jack splitter if you're both have headphones but you're connected into the same speaker or listening device. And yeah, just making them comfortable, and then observing, I think, is the other thing. Are they enjoying the music? Are they dancing? Are they smiling? Can you do mirror movements and do what they're doing? If they're grimacing, if their arms are crossed, if their hands are over their ears, if they're telling you, I don't like that, if they're walking out of the room, then either it's not something they enjoy, the music is too loud, or it's just not right for that moment. Because again, we really want to join people living with dementia on their journey. And I always say, let them guide the experience, especially with music. So you might need to redirect or reapproach or try again later, but never force the experience, I think, is also really important to keep in mind. And I know I've got a lot here, but the other thing that I would like to mention, and that's just because I don't think it's talked about enough. Sure. And I just want caregivers and people who are using music to know this. A lot of people think that music has no side effects. And now it doesn't have significant side effects like medications do, but not all music is beneficial to all people, right? Going back to preferences, we all have music we enjoy and music that maybe we wouldn't want to hear. And so it's important to keep in mind that music can bring up complex emotions for people living with dementia, just like it can for us. And so one example I always give is if someone loves hymns, it's noted in their intake paperwork, they love hymns, play hymns, all their playlists are hymns. And so you put on their playlist, they're happy, they're singing, you leave the room. You come back and they're tearful and they're upset and they can't really tell you what's going on. And maybe it's because they just listened to Danny Boy and they love that song, but it reminds them of their son's funeral. Maybe it was played at their son's funeral. And so now it's bringing up these complex emotions, and they might not be able to articulate why they're upset. That's really hard for that person in the moment. And as a music therapist, I'm trained to help someone process that. But as a caregiver, you might come into the room and feel like it came out of nowhere. So I always say, think about, was music playing? If it's coming out of nowhere. And I'm not saying it's music. It could be medical. It could be a UTI. It could be something else going on. It could be the environment. It could be, they were just overstimulated, or they're too hot, right? There's so many things it could be. But I think a lot of people dismiss music because we always talk about how amazing it is and how positive it is. And I just like to share with people that it can also bring up emotions of tearfulness, of sadness, overwhelming emotions, and so it's just important to recognize that. And then if it's happening more often, to seek a professional, whether that's your care team, whether that's a music therapist, and see if you can explore it more.
Okay, so I want to highlight two things here.
Yeah.
The first is that you just unpacked like a treasure chest for everyone.
Yes.
Yeah.
I mean, really and truly, in a very clear and thoughtful way.
Thank you.
It was also a lot of information. So I will encourage, if you are listening to this now and you haven't downloaded the episode yet, this would be an episode to download so that you can go back and re-listen to it, take some notes, because Tara is just dropping diamonds all over the place, and you're going to want to have some of these in your back pocket. The second thing that I would say is I think you've also really demonstrated the fact that you are incredibly well educated, that you are a clinical expert as well as an expert on music, and highlighted for me really the fact that not just anyone who likes music can go and do this job. That you have clearly demonstrated, I think, the real value of working with a licensed and certified music therapist, because it's not the same as saying, I love music, I'm really good at talking with people, and we can sit and enjoy this together, because of the incredible depth of knowledge for both the benefits of it, how to effectively use it and work with an individual or a group with music, but also understanding the potential side effects and precautions that can come along with it too. And so I just want to really highlight that level of expertise that you have demonstrated on behalf of yourself, but also your profession, because I think it's really important for people to understand that there are professions that go through a ton of education and certification and licensing for a reason. And it's because we want to turn out professionals that are really, really great at what they do. And we want to make sure that people are accountable for what they do. So that was amazing.
Thank you.
Thank
and
you.
It's very validating to hear that. So I appreciate that. That's
sure,
our goal, obviously. And it's not to say that entertainment or someone who's coming in and volunteering and playing the piano, they all have their place. I used to be an activities director, but yes, it's to show the difference. And a lot of times I say, sometimes you need to see it to understand it. I try to paint a picture. But the other thing I would mention too is there's a lot of free resources on my website. If you follow me on social media at Harmony and Dementia, I love your dropping diamonds. I try to drop diamonds
Hey.
on my social media as well. So, and I'm always happy to answer questions because I know it can be a lot. It can be a lot of information and it can sometimes feel overwhelming. And that's never my goal, right? Especially for people who are caregivers and people who are caring for someone living with dementia. I want it to be attainable and I want them to feel comfortable to try it at their level of comfort, whatever that looks like for them.
Would you talk, and I know we're kind of coming up on time here, but would you talk a little bit more about how music can be helpful for the caregiver themselves as well, beyond just the person who has dementia?
Yeah, that's another area that I love to talk about that I've done different workshops on. Self-care for caregivers is so important. And I think a lot of times that's changing, but a lot of times when we think self-care in the media, you think a massage or a pedicure or something that is time and money, which caregivers don't have or can't, a lot of their time and money is devoted to the person they're caring for. And a lot of times their care is being neglected because they're so focused on who they're caring for. And I think music can be really attainable and you can do it in 3 to 5 minutes, right? You can do one song. So maybe you don't have an hour for self-care, but do you have 3 minutes? Can you listen to your favorite song or a song that makes you feel a certain way? Sometimes caregivers, it might be difficult to access emotions. You might feel like you need to cry, but you can't. You might want to scream, but you're not really, you don't want to just like scream out there. Can you put on a song and just get it out, right? Like I have a playlist called Windows Down and Cruising, I think is what I titled it. But it's all songs that I play very, very loudly in my car, windows down. I sing at the top of my lungs. And, is there a space in your house where you can go and it release those emotions so you can better care for yourself, so you can better care for the person that you're the primary caregiver for. It's also, music is a great motivator for exercise. So again, you might not have an hour to exercise, but can you go up and down the stairs a few times and put on music and go to the beat? Can you walk around your backyard with music on? If you need, I talk about box breathing because that's really attainable, where you breathe in for 4, hold for 4, breathe out for 4, rest for 4. You kind of visualize a box as you do that, setting that to music. So breathing at your own pace, finding a song that's kind of a little bit slower, that's a little bit more comfortable to breathe in and out. And that's something you can practice before you provide care. So can you do a breathing exercise? And you can look up breathing exercises and in different ways we'll walk you through different types of breathing exercises. But is there one that feels good for you? And can you pair that with music? Journaling is another one. So sometimes, journaling can be difficult or you need a prompt. Can you use a song? So I love the song Flowers by Miley Cyrus. Thinking about that chorus, we do fill in the blank songwriting sometimes. So could you take out some of those words and make it meaningful to you? So instead of I can buy myself flowers, what's something you can buy or what's something you can do for yourself? And so that could be a journal prompt, or that could be a reminder of, okay, how do I take care of myself? So there's a lot there, but those were probably some of the most attainable ways. And I think because we all have easier access to music now with it being digital, that makes it a little easier as well. It's not as expensive. You might not be able to dedicate the time to go see a live concert. Can you go on YouTube and look up, Willie Nelson's coming to mind. I don't know why, but that's who popped in my head. I love Willie, but and he has lots of live performances. So can you look up Willie Nelson live in concert or live at ACL, Austin City Limits, and watch a song or two? And so over your day, maybe you watch the whole concert. So you can't be there in person, but you can still have a concert experience because you're watching it live from somebody else's recording.
I love that so much. It's a great like mixed media way to provide self-care and use music to facilitate other things that are also known to be helpful in self-care and managing your own self so that you can be your best self in order to care for somebody else. So thank you for giving us all these gems.
You're welcome.
And so you mentioned that you do a lot of this educating in like small nuggets on your social medias. What are your social media handles and where can they find you?
Yeah, so it's at Harmony in Dementia. And so I'm on all the things. But so you can find me there and I share, snapshots from my day, tips and resources, why music is important. It's a collection of stuff, but it's for caregivers, professionals, students, people who are interested in music therapy. We just had World Music Therapy Week. So I did a lot specifically talking about music therapy and why it's beneficial. And then my website is just www.harmonyindementia.com. And I also have a whole list of resources on there for caregivers. So resources for people who are maybe caring for someone with younger onset dementia, resources for just dementia, resources for people in the LGBT community. So I've got a lot of different accessible resources that are also free. And I'm hoping to add some ageism resources because that's another area of interest for me that I'm starting to do more talks on. So,
of course, we will make sure to link that website in our show notes. So whether you're listening on whatever streaming service you use, or if you are watching this on YouTube, you can make sure and find Tara Jenkins and her website right there. So you can make sure to follow her and see all the information that she's got. If you made it to the end of this episode, then thank you so much. We hope you enjoyed it. And if you enjoyed it, take a second, go back, see some of our other episodes, download them, leave some comments, like and subscribe, because those are all great ways to help us make sure that we are reaching more people like yourself who can enjoy this information and benefit from the information that we try to share here. We will see you next Friday, right back here on Care Lab. Bye.
Bye, everybody.
Bye-bye.